getting our people to speak about HIV is sometimes difficult. But at the same time, we were able to contact many of them through channels that are already known. That is why the study researchers are made of people who actually know the community, like even going through church or through community places that are already known where ACB people go, or when they have like events like soccer during summer, or they have any kind of event where we have like some countries have a special event in summer. So we're using all these venues to talk to them, and because we know that this is a serious issue, so we go to people who are already known in the community, who actually get to engage and get to convince people to come to listen to us. Some people were open and to discuss the issues, but still, as I said, it's a taboo. So depending on the places where you get them, that is why the interview is set up in a way that people are given the opportunity to be in places where they are comfortable to talk. The qualitative part of the research produced a lot of interesting findings, because most of the factors that increase the vulnerability to HIV were, I wouldn't say new, but they weren't the traditionally known factors that, like I mentioned before, the assumptions that people made. We had people discussing about themes like masculinity, love, racism, anti-black racism, and structural barriers. You have newly landed immigrants that weren't able to get their degrees evaluated, and it prevented them from getting the kind of jobs they used to do in their countries before they migrated to Canada. So these were factors that few people probably gave a thought to it, that it might increase the vulnerability to HIV.
Black men highlighted the structural issues that impact on them. Racism, structural racism. These issues impact on individuals and create conditions that make it vulnerable for them. People talked about not having the right employment, so being underemployed and not being able to be the man you're supposed to be in your family. They say masculinity means being able to provide for your family, being the responsible person that can provide for your family.
When we're looking at economic status, the data showed that this demographic found themselves to be at a lower income bracket, approximately about $19,000 a year. So again, men that are in a financial situation where they're precariousness in terms of work and job instability. But where I can see there being a correlation is that sometimes the gap between who we want to be and the realities that we find ourselves sometimes can push us to have certain types of unhealthy behavior.
We are impacted, right, in several ways. Even when you take there's something we call healthy immigrant effect. Like when the immigrants come here, their health is up and above that of an average Canadian. But after 5 years, then their health begin to deteriorate, okay, below the average Canadian. The studies have shown these are some of the struggles with the immigration system, and especially if you're a man, okay, a man in Canada here, and you know we blacks, men are the anchor of the family. We go out there to work and bring money in, right? So if you're a man and you are getting very frustrated because your credentials are not accepted here, and then because of that you are discriminated against, you are not getting the job that your qualification should allow you to get, you get very frustrated. And that accounts for the mental health that is on the ascendancy, especially among black men in Canada here.
We also heard clearly from them that sometimes when you're new to the country, you've migrated to Canada and you find out that everyone looks normal, healthy, there are no billboards talking about HIV, you just think, oh, there's no HIV in Canada. So you don't take the same precautions you may take if you were say living in Africa, where billboards and some other things really points to that. I remember the story of this particular person that talked about going to, and I'm talking about HIV is not mainstream here. It's a specialized field with specialized people that work in that area. And this man talked about going to the hospital and just finding that once you're seen at that clinic, HIV, where HIV patients go, then your name goes out in the community. So the stigma still a big issue in our community. And so he said, I would rather go back to Africa and go to a village and die there, instead of me going to be seen by people that I go to this HIV clinic and people can actually detect that. I remember I conducted one of the interviews and another man talked about how he was hiding his medication so badly, but a friend was able to find this medication in his bathroom and told other people about his HIV status. So the stigma in our community still creates problem. And so when we talk about addressing systemic barriers, we also need to continue to work on stigma even in the community, whether it's education, how we promote the current knowledge about HIV, that is no longer a death sentence. People actually need to get tested. We do not have the same level of testing happening in our communities as well.
Understanding all the social determinants of health that impact a person's health and well-being is also key. So from health is one component, but we need to understand the context of which someone lives their lives. So, unemployment, for example, low education, where somebody lives, poverty, all impact somebody's health and well-being. And we can't isolate and look at these things in silos.
They talked about love, that actually black men love just like mainstream people, but the way they express their love is shown differently.
Some people will say, oh, black people actually, or heterosexual men don't know how to love. And that kind of assumption are based on the fact that they don't understand some of the things going on in the community or in the culture, what our background is. Like some people, particular people of certain age who came from Africa, they have different way of showing love. Love is not in public that they will show it, like they won't kiss or do things with a family or their wife or kid in front of people, and that could be interpreted in a certain way against the community. But actually, it's just a different way of showing love. Some of the participants emphasize the fact that providing for the family is a way to show love. The head of the family who cannot provide for his family, this is a big issue. When we talk about the resilience in the black community, many people say, oh yes, black community is very resilient. We went through slavery, we went through so many things, so we are very resilient. Yes, at the same time, we have to be careful and make sure that it's not because our community is resilient that we don't need help. And sometimes that is even being used against the community. Like, okay, you guys are resilient, you don't need that much help. You don't need that much support. And this is one big issue, because it's not because we are able to fight and go through so many difficulties, so many adversities, that we don't need the support. We still need the support. And I just gave an example earlier when I was talking about people getting here, not seeing so many news about HIV, then they feel, oh, it doesn't exist because they don't see it, they left it back home, that's where the HIV exists. No, we need it here, so that's why we still need that help to keep the education about HIV going.
There was kind of that openness that I had not seen, what I call a vulnerability, people kind of wanting to open up and they're holding back, but eventually as we progressed, you have these wonderful conversations around many of these subjects, very freely flowing. Talk about love. For us, actually, the weSpeak project, as a church, I would say it strengthened our structures as an institution, because we were able to speak about the place of men and our cultural approaches to issues of relationship, and more than relationship, to the issues of HIV as well, and the issues of sticking to one partner. Usually we speak about these issues from the perspective of faith. God expects you to have one partner, but having this honest conversation outside of God and just saying, look, this is just the truth about life, that it's good for you, it's good for your health, it's good for the safety of your children, that you stick to a partner. Those kind of conversations that we began speaking about through the weSpeak engagement were very helpful for us as a faith community.